Well, Dad, let's move on to certain tests, health screenings that people should have done on a yearly basis. Let's start off with the heart. What should people get done for tests in terms of the heart?
Oh, I think C-reactive protein is still really cool. I mean, it shows that if you do have a possibility of inflammation, because we know that inflammation is the root cause of heart disease. And while I'm on it, I think anybody, any good cardiologist, if they check C-reactive protein, they should look at Lp(a) as well, because that's a pro-inflammatory mediator. It's the real cholesterol story. It's much more common now because of the Biogenome project. We used to think it was rare, but now it's very, very common. And I like interleukin-6. In other words, these are pro-inflammatory mediators. And even my colleague, Dr. Nicholas Perricone, who was an NF-kappa B guy, I mean, he was the one that really taught me about NF-kappa B decades ago. Any of these inflammatory mediators we can measure. And if you do have them, they do enhance inflammation in the body. Yeah. And by the way, one of the miracle aspects of CoQ10 is that CoQ10 suppresses these inflammatory mediators. So, CoQ10 has enormous utility, not only for the heart, but now I'm reading about more and more papers about, the non-cardiac ramifications of CoQ10, and it's subduing inflammation in this day and age is really cool. That's why CoQ10, I think, is going to be coming, more and more mainstream, particularly, in this era of, inflammation and epidemics, et cetera, et cetera.
Mm-hmm. Dad, you mentioned IL-6. Do you know anything specifically that can help lower that, or is that tied into all the lifestyle stuff that we're discussing today?
Well, interleukin-6, again, it's a pro-inflammatory mediator. So, any of the anti-inflammatories would help. I mean, quercetin may help, omega-3 essential fatty acids, certainly CoQ10, any of these nattokinase, lumbrokinase, any of these things can help to assuage these inflammatory mediators, and even niacin. Now niacin is kind of cool because it's a B vitamin, but what niacin can do is it can intersect some of these inflammatory mediators to a degree, not as much as maybe lumbrokinase or nattokinase. But niacin has an effect on these, and I've seen it. So, the only problem with niacin is it's the flush. A lot of people can't tolerate it. And even in low doses, they get very, very afraid. I've seen panic situations where they get so hot, they get burning and stuff like that. But some people, like the hot flush. So I've had some patients in my cardiovascular practice swear by niacin, and other patients, they couldn't tolerate it at all. It's an individual thing, that's for sure.
And is this something that people build up to, or do they always get that?
Yes, they can. They have to start at very low doses. And, niacin was one of my go-tos for lowering Lp(a) or helping to neutralize Lp(a). But again, you had to go to higher and higher doses.
Got it. Okay. Well, Dad, in my practice, it's more, preventative medicine. I'm not treating patients like you were in terms of like heart attacks and all that kind of stuff. But I like to run a CBC, a comprehensive metabolic panel, thyroid panel, hemoglobin A1C, fasting insulin, ferritin and iron, a hormone panel, depending on kind of what someone's coming in for, depending if it's a female or male, but we'll do like an estradiol, progesterone, testosterone, FSH, cortisol, pregnenolone, DHEA, and of course do a lipid panel with an Lp(a). We'll do a vitamin D, a vitamin B12, including a methylmalonic acid, which is the breakdown product of B12. RBC magnesium, like you mentioned earlier, selenium and zinc, and there's other tests, of course, but that's kind of like what I like to have on a yearly basis are those tests to kind of make sure that we're not missing something and that something's not elevated or low for that matter.
Yeah, and you may have mentioned it, but do you also order a fibrinogen?
On some people, yes. When I suspect that there's a family history of cardiovascular disease, or currently I'm suspecting that, I'll do a fibrinogen.
Yeah, and any postmenopausal woman who smokes, you must get a fibrinogen, because I saw alarmingly high fibrinogens, and I used to think that one of the reasons why heart attacks went up 400% in postmenopausal women. I used to think, when I was a younger cardiologist, it was estrogen because they lost the fountain of youth hormone. But then I realized that the fibrinogens went up. And when the fibrinogens, which causes blood clotting, by the way, the fibrinogens went up because of a lot of smoking, Then I put it two and two together, and I realized that fibrinogen in smoking women postmenopausal was really, really bad. And I had to coach these women in either, lowering fibrinogen or, better yet, getting them off smoking.
And Dad, explain to our audience fibrinogen and how that impacts the blood in terms of making it thick.
Well, it interacts with fibrin, and basically it makes the blood more sludgy. Well, look, if you cut yourself and you're bleeding, you need this stuff because you want your blood to clot. The problem is you don't want your blood to be like red ketchup all the time, sludgy because of these, inflammatory mediators, so to speak, and smoking because, you're not only inhaling, carbon monoxide and stuff like that, but there's like 4,000 chemicals in cigarette smoke because of all the insecticides and pesticides. So, this tends to make the blood sludgy. And we know now that it's sludgy blood or red ketchup blood that is really the essence of inflammation. And we know that inflammation is the essence of heart disease. So keeping the blood like red wine is really key. That's why, I'm a big proponent of grounding. And, again, I like natural blood thinners. So,
exactly.
they're really important.